Another aspect that we're going to discuss in these 2 days is the interconnection between the health of the planet and the health of human. We rediscovered this during the pandemic, but we need more prevention and new treatments. We need One Health. This is the idea, the concept that has been discussed during the Health G20 that took place in Rome before the break of the summer, and the Global Health Summit that the EU and the Italian government organized again in Rome last year. We do have one of the main experts in this field, which is Dr. Maria Neira, who's director at the World Health Organization, which she's in charge of public health, environment, and social determination of health department. Welcome, and thank you so much for joining the F20 Climate Solutions Forum.
Buongiorno Italia, and good morning everyone. I hope you are not too disturbed by the noise of the place where I am. Life is returning, as you know, so we are traveling again. Thank you for this opportunity. For the World Health Organization and at large, the public health community, this is an important opportunity to move and provide what we call the health arguments for more climate action. And in fact, in a few days from now, WHO and many professionals working on public health, millions of them, we will present in what we call the health argument for climate action, which we hope will allow all of us to understand those interconnections between human health, animal health, and environmental health. And if we want to reduce our vulnerability to recover after COVID-19, we definitely need to invest on this primary prevention. The good news is that if we implement the Paris Treaty, this is already a kind of primary prevention agenda, a public health agenda. And that's why we are asking all of you to move on this health argument. A few days ago, we were proposing new guidelines, new values for air pollution, for air quality, much more stricter than the ones we had before. But the good news is that if we implement the new recommendations of WHO regarding the PM 2.5, the particulate matter on the air we breathe, if countries are able to reach that level that WHO is proposing as the one that will not harm our health, we could prevent 80% of the 7 million deaths that are occurring now every year due to exposure to air pollution. I think this is a very concrete action for which we are calling the G7, the G20, the COP26, the COP15, and any organization around the world put pressure on your governments, on your politicians, on your mayors to reduce the level of air pollution. That will be good for the climate, that will be good for health, that will be good for the economic recovery and for the social recovery as well. So this is something extremely concrete that we propose as a solution. Of course, in order to reduce air pollution, one of the key issues as well is this healthy energy transition that we need to move quickly to renewable, clean sources of energy to stop this polluting combustion of fossil fuels that is represented such a horrible harm for our health. We need the transition as well at the urban level, on a healthy urban planning. We need a transition as well on our healthy food systems that will allow people to get healthy diets and reduce as well an incredible mortality and morbidity. And of course, WHO, with the broad public health community, we will try to reduce our own carbon footprint, means the health systems which are contributing as well to the carbon emissions. We will reduce it, and that I think will be a very good contribution to the whole system around the world. Can, of course, those who are polluting at the moment, we still have many places in the world where there is not access to any source of energy at all. So we will insist as well on the importance of resilience and climate adaptive resilient health systems, and this will be our contribution. I call all of you to please use this strong health argument. We are convinced that if we put health on the table, people will be very much motivated, and hopefully they will stop, we all stop to pollute whatever we touch, water, food, and the air we breathe. Thank you very much, and grazie per questa opportunità. Spero che tutto vada bene, and let's go for the solutions and prove the young generation that we talk, we do blah, 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 but we can take action as well. Thank you very much.
Absolutely. Grazie ancora, dottoressa Maria Neira. Grazie. Thank you so much. We really appreciated you being in two different places together at the same time and working also on our summit. And we will discuss and we'll get in more details, Connie, on these different aspects which makes the whole things together